plan drafted by the deadline, which is now May the 5th. So it doesn't have to be complete by then, but they need, a good portion of it done. So I know some subcommittees, they've had different reasons for not being able to get together, and right here at the end, we just kind of had to step in and say, let's meet and work with what we've got and get our goals down. So thank you all for being here today. Apologize for the rain mix up, and but I like to get what we need to do done and get out of here and move on to the next meeting. So with that, I will call the subcommittee meeting to order. And I made just a short list myself of things that I'm aware of and would like to talk about, and feel free to offer your suggestions as well, and with the goals, and so we will just collaborate and make our list. Thank you so much. So as far as advocacy and policy, the first goal that I sent out in an email to everybody was to advocate for policies that improve the lives of individuals with Alzheimer's disease and related diseases, Alzheimer's dementia-related disease, and their families. So an objective would be to advocate for the passage of legislation to improve care and support. We do have, Nathaniel, did you bring copies of that?
I did not bring physical copies.
Okay.
Can we go get copies made or something?
I can email it to my, you sent it to me, didn't you?
I'll send it to you right now.
Okay, send it to me right now, and then I'll email it to my clerk, and then get him to bring everybody copies. We can do it that way. The Alzheimer's Association has some suggested legislation, and we had a previous recommendation as well, so we can submit both of those. Which, Nathaniel, which email address are you sending it to?
House email?
That'll work. Can you talk about it at the same time? Do y'all know Nathaniel White? Did not introduce him. Nathaniel is the new state director for the Alzheimer's Association. And so we're very glad to have him on board, and he's just been out of the gate like a racehorse, getting things done, and just picked right up and taken off with it. I know he's going to do a great job. Can you tell us about?
It's been a fun 3 weeks.
Can you tell us about this recommended legislation that you're sending us?
So the Alzheimer's Association is proposing legislation to really focus on public awareness, both in partnership with the Department of Public Health as well as the Department of Senior Services. So we're really leaning into senior services through AAAs to target a certain demographic who need to be very aware of dementia and Alzheimer's risk, as well as data and information from the Department of Public Health, so that public health can inform healthcare providers on information related to risk reduction and early detection. We know that some of this overlaps with the BOLD grant. So we did include a sunset provision because we do not like unfunded mandates.
Neither do we.
Right. So I did take that into account when writing this book. But we feel that this is a good complementary layer to the efforts that we are currently doing for BOLD, our task force, and our grant. So, and is a good step in the right direction for modernizing some of the language in the Alzheimer's and Dementia Education, Care, and Training Act.
What would this legislation, when would you introduce this legislation? Is it something that's actually, I'm just curious. Is it something that's already out and I've missed it? 'Cause I
No,
haven't
no.
seen- Okay, I was gonna say, I haven't seen that.
He
so-
just emailed it to me, and my clerk is, I hope, sees his email and will
Yes,
print
ma'am.
them and bring them to us.
That'd be, okay. So that's, you're gonna introduce it this session?
Yes.
So I hope to have the copies in just let me text him too.
All right.
So that hopefully he sees we need something right away, but we'll get that to you. The other, piece of, legislation that we have is creating the position of Dementia Services Coordinator. And so, we have that now as part of the BOLD grant, being paid for by the BOLD grant, and that's one of the biggest items I would like to see come out of this, is making that permanent. And so we have a bill to do that. I don't know if it's gonna be needed, but we'll talk to the governor's office and see. But certainly, when you look at the other goals and objectives from the other subcommittees, we need that person in place to be over all of it, and also keeping the BOLD coalition together and keep that moving forward and actually taking the action to accomplish all of our goals. So that's one of my top items I would like to see, is that position.
And that's housed within where?
Department of Senior Services.
All right.
I wouldn't be surprised that we would need something like that, just because my
Absolutely.
experience out over the years is different administrations come through and different priorities come out, that just, if we even, struggling through the interagency council to prevent elder abuse, trying to continue that way. That's been going on for a long time, but it's a struggle, just constantly changing leadership and having that move forward and continue to be active.
Mhm.
So I think you'll be happier to go with it.
So I have that as well, and that's a recommendation that I have that I would like to see.
Representative, would that be coming out from the BOLD grant as far as paying that salary and coming out of one of the budgets? Which
Well, the
budget?
BOLD grant is temporary. It's through Department of Public Health, and they're coordinating with Senior Services to pay for that right now, and it's 5 years. So,
Okay.
but it's just gonna be a very important position, I think, inside of Senior Services. So, and Tracy's doing a great job. It's Tracy Dunklin, and I'm sure y'all have met her, and she's doing a great job. And if she would like to, I don't know if it would be her, but hey, she's
She's doing a good job.
yeah, she's been in it, since the get-go, and so I'd like to see her be able to continue beyond the grant. Okay, so we will, add that. I'll put that on the list. I'm kind of clerking too, since I clerk, so I'll type this all up later. I used to take notes for a living, part of my job, but that's what I was just listening and typing. It's a lot harder for me to talk and type, but I'm trying. The second objective is to establish a coalition of advocates to influence policy decisions, and we have that with the BOLD coalition. So in some shape or form, we need, I think, to continue that, to be able to meet the goals. Thank you so much.
Absolutely.
You're checking that email today. I appreciate it. Thank you. So I think as one of the one of the objectives of the first goal would be to be able to keep that coalition or a coalition of stakeholders together, working with the Dementia Services Coordinator to reach our goals, and also to review the plan every 3 years. I think that's our third objective, so that one would be covered under that as well. Some other notes that I made, the Alzheimer's Association has an annual Advocacy Day, and so I think that's important for them to continue that. I would recommend that they continue to do that, and with, with Daniel in place now, I'm sure that he would keep that going, because anytime we can make the news and keep public awareness out there and to advocate for for this issue is important, so I think that would be another, objective of the goal. And we talked about the legislation. Lastly, I had about keeping the coalition going. So we've covered everything that I have. So I was interested to hear if any of you had any other recommendations for a goal as far as advocacy and policy.
So I'll just jump in. And I apologize for not having something more cohesive. I had in my notes, I didn't know if you had seen, but the state of Illinois had pulled together a caregiver portal, a resource and portal act that kind of directs people what to do and how to keep all the resources in one place and to help promote. And I thought that might be a nice addition to your promotional things, so that people will know where to go and to point people to, and then also to ensure that it's there. So I brought, I only have one copy of the bill from Illinois if you want to look at it, and then I can put my notes together and send them to you next week.
That fits into a thing that we have had across different
Right.
subcommittees is
The thing, yeah.
like a website, we talked about it yesterday as far as research and innovation about how to direct people, to let people know that there are studies out there, how to get in contact with them, be a part of a study or trial if they choose to be, and what all's involved
And an
with that.
aggregated place, I think, with that coordinator, right?
Right.
Because they get services on every level of every agency
Right.
to someone who is either a caregiver or a person with Alzheimer's and dementia. So making sure that those funnels of information are going somewhere that we can find them. And
I think that fits very much into, like I said, across other areas, other issues at the subcommittees is whether it be a website, through social media, however, to connect people to the services that they need. And also, we talked about one for researchers yesterday, a work group for the researchers to get together, so.
That is hard.
Yeah.
Well, we tend to talk about family caregivers as like saving them time, saving them money, and making sure they have the resources and support that they need to do what they need to do with their family members. And so, you can tell me if I'm wrong, but if there's a way to, when we move forward with the dementia services coordinator and the coalition, to make sure that we're constantly looking for opportunities to either bring in grants or update and change policy with when new data comes in or when the opportunity comes forward, so that they feel empowered to, if there's a solution, if there's a demonstration project, if there's something new, that they are empowered to go after that and not just kind of holding space doing only what was prescripted.
That also ties into what we've already talked about in other subcommittees as well, is about collecting the data and also what to do with it.
Right.
And then as far as the funding goes, looking to see where, gathering everything together in one place so that it can be utilized and see where the gaps are, where more funding is needed. And also, I think that fits with the policy as well, if there needs to be a change in policy. So that does tie into overall.
I 100% agree, and I think just as somebody who's had to ballot myself, you don't know where to go. If there's one website that we could push on social media that says, is your family dealing with dementia? And they, one click and they go to a website where all this stuff's together, that would help people tremendously.
And something that could aggregate the
I'm concerned a little
information.
bit about the generational gap, because I know that my parents would probably more likely call an 800 number.
Yes.
Just for probably the next, 10, 15 years, then that's not a barrier. So maybe an 800 number that then accesses to the website, or maybe
You
you
do both.
suggest, yeah.
It'll all be
definitely,
tied together. I know that,
As the kids, a lot of times are more website, you know what I mean? Like,
Yeah.
we're the ones trying to figure out what to do.
And they'll find it and give them to the parents, which is fine.
Yeah, I would think that's part of the overall,
Yeah.
overall kind of public awareness plan, or the
I agree.
promotional and PR plan. That would be an element or a tactic that we would
Yeah.
push into, because I think that's just the best next step, right? To have that conversation of how do you, in a professional, organized manner that can move forward. And because I don't know how many people kept up with data for so many years, but it was in the 1970s all the way through the 2010s. So trying to figure out how to keep that active coordinator, keep them engaged, keep them collaborating. I think with the coalition behind them, I think I wanted to mention one more thing, and then I'll because I probably have too many things to say. But we also in other states have seen maybe in the future an opportunity to do a modest caregiver tax credit. We have seen those in other states. Any of you who have taken care of someone know how expensive it gets just picking up incontinence supplies and just other things. So, and it has to be flexible enough to meet the needs that you're dealing with, and helping, just like you hear with the children dealing with caregiving and daycare and all of those expenses. You see the same thing on the adult side, but with much fewer resources. And I think we'll see all of that hopefully start to evolve more because the boomers and them aging into the older population. But that's all in a mix, right? So I just wanted to throw that out there because we have different models, either through grant programs or actual tax credits, where the one in Oklahoma, for instance, very modest, but it was more if you're a veteran, and it is more if you had Alzheimer's and related dementia. So, because that's just extra fun, right? But it's really flexible.
Well, before we leave the caregiver portal, one-stop shopping, we talked about that in like the Grandparents Commission and other ways where people are trying to access information, how to get them information that they need. And another point was that we touched on, but just to verbalize it, you've got the people who need the services are usually older, and the ways that they're going to get information, but their family members or caregivers who are trying to help them, they may get information in a different way. So we do need to have it, whether it be an 800 number to a website to whom to contact. So we need to cover all of those spaces.
Even 211.
Yeah, definitely.
They're
about
as
long as it's a secret. I think they're about, at least some of it. 211's working on a national grant with us to provide some of that information. I'll have more information later once it's all the stuff is handed out. That hopefully will help. And I actually, although I like the idea of no wrong door, so that coordination is really comprehensive and all inclusive. Hopefully, all inclusive, but inclusive. So no matter where they go for help, they get to the same place.
Right. Anybody else? I think these are all good.
Robin, I figured you'd have something about first responder training or your elder abuse.
Yeah, sorry, parking wasn't,
I should park in my office.
Yeah, that's okay.
I won't.
Yeah, so what do you want?
We're talking
Sorry.
about the goals and objectives for advocacy and policy. We have talked about legislation and we've got a copy. Is there another? We've got
I've written all of them.
got a copy of legislation that was recommended by the Alzheimer's Association, and I know he's cleared that with the governor's office as well, and her team. Also, another a bill to make the dementia services coordinator a permanent position. That's something I really wanted to push to come out of it, to be over keeping a coalition of people together to keep reviewing the state plan every 3 years and carrying out the goals and objectives, taking those action items. So that's where we're at. We talked about the annual advocacy day that Alzheimer's Association does every year, and a one-stop shopping portal to get people the access to the care that they need, whether that be the person suffering from the disease or their caregiver, where they can go to for help, and also maybe a tax credit to help folks who are taking care of their. So that'll get you up to speed.
There you go.
That's all.
And so, but I'm talking fast because we have to be out of this room by 10:30.
Oh, wow, okay.
And so, but I think we've covered everything, and now we're up to you.
Yeah.
So, do you have some recommendations for us as far as?
A couple thoughts I do have. I know there's one piece of legislation that is for newborns, for tax credit, for diapers and things like that. We serve a lot of people with dementia and all of them are in need of incontinence supplies.
Yeah.
So why we don't piggyback on that and just say also including maybe people over the age of, or,
Well, we've got that bill coming up, I might be able to make that happen right now.
wow, cause
that's
it's
good.
very
It's
expensive for
very,
families.
it's the number,
I
that
know.
and respite are the two things
I-
we
I
hear about the
know.
most.
Yeah, we run this Panda project.
Uh-huh.
We started it in Shelby and it's in other counties now, but that's the number one thing that they, because the care recipient is the client, is the Panda client as well as the caregiver.
Mhm.
So we focus on both and we put care plans together for both people in the home.
Well,
And that's unheard of,
I'm
really.
gonna try to make that happen now.
Yeah.
We've got that bill coming up, about, diapers and.
Who's sponsoring that?
What's-
Uh, Insler or,
Is it
Rafferty or,
Cause I think I
Let's see if I can
sent
look it up.
Anna-
Mid Lands, I
Let's
can't
see.
remember.
I was teasing Door this morning because he has all the feminine hygiene product bill
Yeah.
and that. I said, I was teasing Dalton about incontinence supplies. He's like, oh Lord.
It's the number one, they just
It
can't
is
afford it.
absolutely.
I know, I
A
know.
lot of places have a diaper banks, and I don't know how that works.
Yeah.
Okay,
Or in Radford.
I'll look into that now, but I'm gonna put it down
Okay.
as,
It's Senate Bill 159 and House Bill 152. 152 is by Rafferty, 159 is by Orr.
And that would be a tremendous help for them.
Let's see where we are.
what's the status on 152?
152 is Rafferty, that is pending committee, action in the House of Origin. What was it assigned to?
You want my glasses?
No, I don't have to have the glasses yet, but Ways and Means Education. All right,
Yeah, cause it's taking
Yeah,
your
taking away
sales
tax
tax.
money.
Mhm.
And then I guess just the last thing is, I kind of developed Alabama's dementia-friendly training for first responders. It's been very well received. It's no cost. We give them CEUs, just more education and training. All the other 12 area agencies are also trained and equipped to do that training. And then I just, real quick, because I'm gonna leave this with you. This is a dementia sensitivity kit. This is the first one we've assembled. So when I go back to the office, we're assembling 600 of these. But this is for first responders after they get the training, or they don't need the training, to keep in their vehicles. And you've probably heard of the Culture City bag. That's more geared towards autism, but this is specifically for people with dementia.
When y'all put those together, can I get?
Yes, that's for you.
Thank you.
Well, and I sent your training to Jenny. Did you get that?
I did.
Because I thought it was close enough. Maybe you could.
Yeah, because we always talk, we share all the resources to those local departments. That's the biggest, and they put like sensitivity, we do the sensitivity training with them. It's been really good.
I did that. I went to one of the areas at the senior centers in my district and did that where you put on the goggles and
Oh, yeah.
the gloves.
It's like we talked about hosting a get together after, like during session, like even especially with like the freshmen.
Yeah.
To talk about and do the virtual dementia tours.
Mhm.
So if
They
you're still
organize.
interested in that, if you want us to do that, we could probably work on doing something.
So I say education and
And see,
training
that,
for
that's
groups.
part
For
of
your
our,
committee or-
that's part of our advocacy
Mhm.
that we're talking about for the Alzheimer's. We should do that on the Alzheimer's Awareness Day. Nathaniel, we should do that. We should set up a room and have that available. We should do
We can do it
that.
on 6th floor.
I'll just add just another idea, and I don't know if this would be something, we won't be able to do this during this legislative session, but in the future, partnering with MASA, the Medical Association of the State of Alabama, because from this report and what we know in our lived lives, there is a huge dearth of providers within the state. And so when you're thinking about, all of these wonderful ideas that we have, you have to have a diagnosis first. And we can suppose, grandma, granddad, whomever, we're seeing those signs, but until we have an accurate diagnosis, we don't know really what the best treatment plan is. And so MASA has several initiatives already regarding how can we recruit physicians to the state, particularly in rural Alabama, and not only recruit but retain. That is a huge issue. We know that physicians that typically train in Alabama when they do the residency programs, they tend to stay. But if there is something that we could think of that would kind of meet this goal, or even just partner with the initiatives, the advocacy initiatives that MASA has, I think that would be very worthwhile. Maybe even getting dementia certifications, or even having providers that they can, put out, hey, we are a dementia certified facility, something like that. So that the public knows we're having this bank of resources. Okay, Dr. Smith in City X, okay, this is a dementia certified, so we'll know that they have the most accurate information. We will at least cut down on some of these statements. Well, that's normal aging, which we know that's not, or there's nothing we can do, which we know that's absolutely not true. So just kind of future thinking with all of these wonderful ideas. How do we sustain that, and then how do we grow from that?
And we'll fill in on something we talked about yesterday as we wrap up, and I hate to rush. I'm so sorry, but rushing to get out of here.
Well, if we need to meet ever again, we're right down the street and happy to host anytime.
Well, I've never had this problem with booking a ring, but anyway, things happen. You just have to roll with it. One of the things that I found in looking at other plans was something that Georgia does. They started in 2017, and it's a tax when people can check off on their income tax return where they can donate money to a fund, and they took this money and the state uses it to partner with Emory University, and we just so happen to have UAB. And so Emory then subcontracts with the providers, and so they have made clinics all over the state where people can go from the very beginning to get diagnosed, get an accurate, get a treatment plan, get other testing that they needed, like the MRIs or whatever, and it's free to the citizens. And now they have, more than twice the population that we do, and it started with $4 million for the first 5 facilities, and they've added 3 more, and then they have some telehealth options as well, and so it's budgeted for $7 million, and so they're able to provide that. So then the college then has it's staffed by a neuropsychologist, and of course you've got a clinic director, but then the students are providing the care and get the training as well, and that just blew my mind. I just thought we have got to pursue, and here they come. They're ready to. So thank you.
I just go across to the other side to finish, or
We could.
we could if you want to.
Well, let's do that. And I'm sorry to make y'all move, but it was a little more comfortable in here.
If the dog is walking.
Yeah, we've all been
Oh,
walking.
that's nice.
Even Dr. Harris walked.
He's trying to get his dog.
It's like glaucoma drops.
Yeah.
Like
Oh,
you see.
no. Oh,
If you
no.
leave him alone long, he'll keep trying to, that poor dog.
You said I heard that.
He also got kettle corn for dinner one night, so it's like everything we got in his Christmas stocking.
We're down 480.
Oh, no.
I know, poor dog.
So.
Oh, thank you.
They're trying to take that statewide, that Panda project,
Mm-hmm.
senior services.
Mm-hmm.
That's why we've got some
Yeah,
stuff
that's
already.
great.
I remember when it started.
Yeah, you were a partner.
I think too with the UAB, but there is a gap of knowledge because the data and the research and the treatments all change so quickly. I want to make sure that we have the opportunity to get that out to the medical community and or the healthcare community and professionals, because that's where people go for help first. And we all know, like you were saying, it's not because you're older. Like that's not
Well,
the
that's
cause.
something we talked about yesterday, is collecting the data and also come on in, we're just, real informal today. So
Making do.
gathering and getting the researchers together so that they can share information and collaborate, and having all that collected in one place, and so that we can utilize the data and
It's
also.
not a specialization, right, or in clinical rotation when you're getting trained as physicians or as nurses. That's not a component, I don't think, so.
Well, it is for your clinical hours. You have to be
Is
in
it?
a long-term care facility. And for physicians, you can do special certification.
Okay, good.
So
Well, we're, like I said yesterday, we're not starting from zero in Alabama. We have a lot going on in research, not only at UAB, but Auburn is doing a drug study. Hudson Alpha is doing genetic research related to Alzheimer's, and we've been able to get a lot of National Institute of Health grants in the state to fund this research, and so we do have a lot going on, a lot to be thankful for. We're not, totally.
USA has it. That's one of the two.
They do. So as we're looking at advocacy and policy, does anybody have any more recommendations as far as an objective to submit for implementation? Y'all been great. We've really covered a lot of ground really fast today, so.
I think we just need to connect the dots. There's such a disconnect with Alzheimer's and dementia. We do a lot of training. People don't know the difference. That's the number
That's
one
right.
thing.
Yeah.
But even whether it's public health or it's one place where a launching pad where everybody knows, like a big campaign, they all know to go to that website to get all the
I
resources
totally
they
agree
need.
with that. That's the problem. We have these great ideas, but the public doesn't know about them.
Right.
It's just like 211. It's the great unsung hero of the
Yes.
state, and most people have no clue that it even, or isn't it 211?
Yeah.
Yeah, most people don't even know it exists when they get in a crisis and they're freaking out. They don't know where to go.
Right.
So, to me, that's key to whatever we do.
It is. It's getting information out there, and as far as the needs assessment, we're focusing on, and what the recommendations were is prevention. So we need to get the word out about there are things that people can do to prevent this disease, and how important early detection is with this disease. So we need that information out there as well, long before that they need the care. So getting that information to the public is vitally important, in dealing with this disease. And that exactly is what was shown with the needs assessment.
And I think the ongoing commitment of the groups to keep the effort going and regenerating with all new
Right.
things.
Because the
Critical.
survey results, the one thing that really stood out to me was, we work for a local area agency on aging, and nobody knows about us, but
That's right.
the consumers who completed the survey said things are not they're accessible, but they're not easily accessible.
That's true.
And we've all struggled even with our own families. I mean,
Right.
Yes.
because of the line of work, we have the better upper hand, but even we struggled with navigating, who do I call first?
We get called about law clinics all the time, right?
Yeah.
Because we're about important papers. So even if you've had an early diagnosis, having the supports and the guide rails and the guidance within already before they're to a point where they don't have a capacity, and making sure that moves. We get those requests a lot.
Well, our AAAs are an important piece to this, because that's where, seniors that do know about it gather to get information. And so we need to utilize those as much as possible and get the word out about those as well. But like you said, even though you know where to go to get help, I was in the same situation, being as knowledgeable, as connected as I am, still how difficult it was to get my sister the treatment that she needed, and how long it took.
That's it.
And it was really too late. And I shared yesterday, once we did get her into UAB and got the diagnosis and got started with the process, now in the next step, that next appointment is September of this year. 6 months after getting the diagnosis. Well, she had such a downturn, it's not going to be beneficial to her, at this point. And that comes from somebody who
Those people.
knew, what to do to get her there as quickly as I could, but it was still too late. So I say it all the time, especially to my husband, when he's hearing me when I'm dealing with everything, because, you're dealing with things like Social Security, Medicare, Medicaid,
You had no idea.
all these, and the Veterans Administration, and being as connected as I am and knowing whom to call, still the roadblocks, and I say, oh my goodness, what does somebody who's 80 years old, when they hit a wall like this, then, how do they pivot and know what to do next? And so I just can't imagine. I can't imagine what people go through, and that's why I'm just so focused on trying to figure out the best ways to get the people who need the information they need.
Yeah.
So this
Quickly.
is,
Yeah.
yeah,
Yeah.
as
Timely
fast as
manner.
possible. And I know if we could do something after Georgia's model, I just think that would be awesome. I know it would take a lot to get that off the ground, but you have to start somewhere. I'm sorry, y'all, I talk a lot.
There you go.
Well, and all the supports,
It
like
was
the
substitute, so
caregiver,
that's
the
good.
support groups and the
Yeah.
support groups are so key. Because y'all know that's, you go to, you try to find somebody and then you feel bad about having your feelings trying to, when you're a caregiver, you just want to fall apart, and having somebody who's been through it and can walk you through it and kind of prop you back up and maybe give you some words of wisdom. And
I don't wanna be gloom and doom, but I mean, I think that the state's gonna be in a crisis.
We
It's
are.
not just the state of Alabama, it's all over the country. And we've done a really good job of elevating children, protecting them from pedophiles, doing all these things. We've done
And
great
mental
work, but we
health.
still have work to do.
Yeah.
But my point is, I feel like as a state, we need to almost elevate the elderly up to that status
Thank you.
as well, especially when
boomers.
it comes to dementia. I mean, cause I'm not just saying from an exploitative manner, just people aren't gonna know what to do. So I don't wanna be gloom and doom, but I do feel like we're up against the wall. We need to elevate this as much as we do children's issues, in my opinion, because it's coming.
it's a workforce
right.
retention issue too, because if you have to take care of your sister, you can't leave her at home, you're not going to be working.
Well,
Oh,
the
yeah.
Elder Justice Center, that's what we try to do, but, we're trying with these countywide multidisciplinary teams because one of every 2 people with dementia are gonna be mistreated in the home.
Yeah.
So that's a huge statistic.
Well, people are frustrated. They don't know what to do either. It's not always that people are bad people. It's
Right.
a very taxing, stressful
Right,
situation.
Exactly.
It just is.
Like over medicating them so they won't set the house on fire.
Yeah, I mean, it may not be slapping.
Both
them. It
bad.
could be
Right.
something else. I mean, it's not necessarily beating somebody
It
up.
could be
It's-
leaving them alone when they
Yeah,
don't know
right.
not to.
Yeah.
Or neglect is abuse.
Exactly. So I wish we could elevate it like that,
Well, I know, like Alabama, they have 67 Child Protective Services Task Force. Every county has one.
That's right.
In Alabama, we have one statewide one that we started in 2011, and we have 3 that our agency,
Yeah.
the Elder Justice Center, has
That's
started.
true. Maybe we
We
can
have
incorporate
Walker,
them
Chilton,
in.
and Shelby. And it's where, they're required for certain grants to even have those, but if we could even just, every county should have a task force dealing with older adults. And they don't. And I understand, DHR, they do a great job, but they're, understaffed. I get it. But,
Yeah, I'm just glad I've got a senior protective, services person with DHR in my county.
yeah.
Is she an FTE or just part-time?
I'm not sure.
Because that's all state budget. No
Yeah.
federal.
I'm not sure.
So they have it
She
real
may be
rough,
doing both. It's terrifying.
Well, I go back to education is
A
power.
lot of it.
And because when I talk to people all the time that call me because somebody's in a crisis and they need
Yeah.
placement, most people don't even know that there's an ALF, which is assisted living, then there's a SCALP, then there's nursing home, then there's home health. Like people, they don't
And the
even
waiver
understand the
services.
basics of
Yeah.
what are the levels of care. And like, okay, they're at an assisted living, yeah, but they've fallen 5 times and they
They're
can't
not gonna
identify
keep
their meds anymore. Okay, we gotta go up a level. People don't even have that basic understanding. And to me, we just gotta educate people on what's even there. So that's why I think your
Don't know the
idea,
difference between Medicaid
I think
and
it's
Medicare.
crucial. Yeah, they don't understand.
They
They
think
think, well,
Medicare pays it
yeah,
all.
Medicare's gonna pay for my mom to go in a nursing home, right? No.
Not at all.
And people they don't get all that. And that's very overwhelming for people. So I'm gonna shut up. It's not group therapy time, but I just think, I really do think that we've got to get more knowledge in the hands of people.
The first grant, so when I worked for senior services, when I was, it was 2000, say, we got a grant for Alzheimer's, statewide Alzheimer's program. The promotional budget for a statewide grant, $200. I sent everybody paper.
Well, that makes me feel better about where we are now.
See, well, that explains why like it's
It does.
just great and try.
Yeah.
And there are more people over the ages, 60 than there are under the age of 18. And it's just gonna get
One in
worse
5.
as the boomers. Is that pig in the python picture we all get, with
Yeah.
aging?
I'm in that group now, I'm in the tail end of the baby boomers,
Yep.
so it's, well, as far as policy and advocacy, do y'all have any more recommendations as far as, other than the things that we've talked about already? Y'all had some really great ideas.
I wanna make sure it keeps going and the conversation continues. So like when you do have the opportunity, say for expanding the multidisciplinary teams or like keeping those ideas.
That's why I think the coordinator position being
Yeah,
made
That's
permanent
crucial.
and a
Yes.
coalition of stakeholders at the table continually
Yeah.
keeping this to the forefront and pushing to meet the goals and objectives that
Yeah.
we've set forth through this whole task force and with the BOLD coalition. So,
We can get some immediate satisfaction if we can get that diaper bill amended.
That
That would be great. That's
I'm
like a
gonna
short-term
try, y'all.
goal. That'd make us feel like we're doing something.
I'm gonna try. I'm.
I have no doubt you're gonna try.
And what about adult incontinence supplies?
That's what we're talking
That's
about.
what I'm gonna do.
Tag it on.
We'll do what we can to help you.
Yeah,
I
tag
can
it
tell
on.
our lobbyists to say, okay, well, let's, of course, you tell me what you want me to do after you talk to them. I go in your
Well, that's my
direction.
action item for today. That's my action item. When I get out of here, that's where I'm
Go
going.
forth and
Just tell them
conquer.
I didn't start it.
So, I saw it and I sent it to Ann and I went, what about seniors? Are they gonna?
No, I asked that about
Well, it's
Ellen.
a good way to raise.
So how
the-
about, you know, the bill that has the, about, sex offenders and not volunteering and,
Yeah.
okay. Why would you do that just for children and not for vulnerable adults?
That's what I'm saying. I wish
That
we could
makes me
start
crazy.
thinking about them kind
We
of,
need to.
handing love.
What makes that not, what makes them any safer?
Did you have anything else? I feel like I cut you off over there when we were running across for the rave. I didn't mean to. Okay.
You got the amen choir with you, whatever you wanna say.
Good.
Hey, stranger.
All right.
Do you have a contact at Nancy that you spoke with about things, about your interest? Just making sure. Cause I can help with that too.
Well, I think, we've got, some good meat here to pass along to the, BOLD Coalition as they get our state plan drafted, and, I appreciate all your help and your input in doing this, because that's what it takes. It takes it's a team effort and putting our minds together and,
We could look, I mean, it's always, I hate to say the money part, but the, making sure that Alabama Cares and the respite funds that are being, that they are, like, they are getting, their voices are heard, that they are getting what they need. And, cause they're very sweet people on there, will just say, okay, we're fine. And
yeah.
like, no, we're not. And I'm like going, I don't know how many waiting lists you have, but
Yeah.
I get calls every day.
The CARES Dementia Grant through ADPH.
Mm-hmm.
Yeah, because they've been doing a bunch of training at all the nursing homes. We've been we're just like tickled to death with the training they do. But that's federal dollars, correct? Yeah, those are
Yeah,
federal
the
dollars,
local.
and all of that, I
Yeah.
mean, I'm not trying to be, that's all, we got to really, as a group, we've got to really alert each other when some of these grant dollars, these federal dollars go away, because something can go away overnight. We have no idea, and it may be important to a legislator, and they may not understand the connection. Just like the research stuff, when you were thinking about that, my mind immediately goes to, you know, those dollars could go away, and maybe we could have advocated or contacted our delegation and, you know, in DC. So I think that's not I don't know if that's a policy objective or not, represented, but maybe our congressional delegation being aware of some of this funding. I mean, I know they're getting hammered by UAB and everybody else, but
They are, because, all the money that comes, you know, from the federal government to the National Institute of Health down to, you know, our, institutions in the state, you know, it's critical. We keep that funding going. They do a lot of good work in a lot of different areas, and that's not waste, and that's not fraud, that's,
Right.
need
Is the
that.
coalition
I agree.
seen as being independent? Or is it a part of an arm of state government?
the bowl thing.
Whatever coalition that we're talking about creating and maintaining? And is it more of a council? Like, do we need to ensure that it has a little bit of independence or a shared authority amongst the interagency people and all the nonprofits, so that, because we've seen things die under different administrations or whatever the priority is of that administrator, and kind of how things shift, and all of a sudden nobody's meeting,
Or just somebody retires.
or somebody retires, and you're very
Well, the
right.
members are from the public and private sector, and so it's kind of coordinated
Yeah.
by the state agency.
Right.
And, just like we've seen with our supplements, people are busy, they've got their full-time jobs, it's, you know, really hard sometimes, for them to be able to participate. However, we're talking about the experts that deal with it on a daily basis, we really need their input. So hopefully, you know, we'll be able to keep that going. That's certainly a big key to making this work and to, getting,
An annual report to the
Access.
legislature so that everybody's aware.
And the training's already put together for different groups. Like I said, we already have the first responder. June 10th, we train all of Samford University nursing students, pharmacy students, and social workers on dementia. It's an all-day training. So, you know, we'll be putting that together for the healthcare professionals kind of thing.
Oh, and another bright spot, the State Nurses Association is having a conference and they're gonna focus on long-term care and dementia
Good.
as part of their training. Their new director, I can't call her name right this minute, y'all may know her anyway. She just emailed me about it
That sounds
yesterday.
good.
Yes, I will.
I mean,
I'll send it to
okay.
you. I'll look at my email.
Because that was until they've got new models, very successful. In Arkansas and Louisiana, some kind of, maybe it's the same model with the greenhousing.
Well, thank you again.
Oh, yes, the greenhouses.
Yeah, so we have a successful one in Birmingham that we have, but they're leveraging it with Medicaid, I think, for smaller, more home communities, or smaller oriented facilities,
Okay.
which is higher outcomes.
Well,
Sorry.
thank you again. I
Alright,
really
you're
appreciate y'all's efforts and participation and input.
Thank you.
Thank you.
Thank you.
for everything you do.
Send up the flag if you need us.
Okay.
If you do need help, seriously.
We'll talk.
Yeah.
I will.
You got my digits. You know how to get me.
Thank you for pulling us together and keeping it
Yes,
rolling.
thank you.
Y'all are awesome, everybody.